My name is Alice Phillips, and I am currently a practicing primary care pediatrician in Fort Worth, where I've had a practice of my own for over 27 years. A few years ago, I started working with our quality team at Cook Children's, and that landed me in a unique opportunity to be a part of a group working on a growing mental health crisis. And so through my quality work, I've been able to partner with our leaders to build much needed supports for my primary care doctors to help our kids in our community. As a pediatrician, I have the unique ability to help kids with mental health concerns. And the most important thing that we do as pediatricians is we ask the questions. We find out how they're feeling, how they're handling life, and we talk to them about it. And as a pediatrician, I have a long-standing relationship with my patients. And so what that gets me is trust. And so I have to talk to them. I have to ask them how they're doing, find out how they're handling friends, how they're handling school, and not be afraid to ask those tough questions about mental health. Parents should feel free to call their pediatrician about mental health at any time. What I don't want them to do is wait until they're at a crisis, wait until their child is self-harming in some way or threatening suicide. I want them to call at the first opportunity, the first time they have any inkling that their child is having a problem. And then we can sit down together and we can talk through it and decide what our next steps are together. The tools that we have as pediatricians to treat depression and anxiety, they're varied. Sometimes all that the child needs is referral to a counselor to talk through their problems. And so our community partners are one tool that we have. But we do also have medications, and sometimes medications are needed. And I really encourage my families to not be afraid of that tool, because if you had an allergy, you're going to take an allergy medicine. If you had high blood pressure, you're going to take high blood pressure medicine. If you have anxiety or depression, we have a medicine that will help that as well. And so we need to not be afraid to use all of those tools in our toolkit to give the kids the best results. I would encourage parents to watch for a change. And, we talk about that all the time with smaller kids, but it's important with teenagers and older kids as well. If there's a change, if suddenly their grades plummet, if suddenly they're not going out with their friends anymore, they're refusing to come out of their room at night. And I get it, some of that is normal teenager, but if it's really a drastic change, they're sleeping all the time, they're not eating, those are warning signs that we need to pay attention to and that we need to have a conversation about.